lot of times we get a question, what is this pain in my neck all about? And it's really kind of a very simple procedure to figure out what's causing it, but there's a lot of different things that go into it. Most likely that pain in your neck started out a while back. It started out as just some stress that led to some muscle tightness. Maybe some postural changes, how long you sat at your computer, or how you were sitting when you were sitting watching TV or at the movies, or how you were bent over working on some things in the garden. But those postural things and that stress gradually end up creating some muscle tightness, and those muscles gradually get shorter. And that shortness ends up creating increased pressure in through the spine, in through the vertebrae, the bones in your neck. What'll happen then is that then you go to start to do something, you're exercising or you're reaching into a cabinet or whatever it might be, and that tension, that tightness that's developed here, that's running from your shoulder up into your neck along the line of those muscles, that tightness starts to pull everything closer together. And so then any kind of repetitive activity like emptying the dishwasher or carrying some groceries or carrying the basket of laundry back upstairs to fold it, etc. Those things, those muscles are already short and they're put under this tension, and it makes them get shorter. And ultimately what happens then is that that tension and that shortness ends up leading to increased stress and pressure down through the spine. So this is a picture of the muscles in your neck. You're looking at yourself from behind. So this is the back of your head right here. This black line is the base of your skull. And then these are the muscles in your neck. So all of the muscles in your neck originate from that spot at the base of your skull. And they run to the vertebrae in your neck. They run alongside the vertebrae in your neck, or they run alongside the vertebrae in your neck to your shoulder blade. So when we're talking about all of that muscle tension, when those muscles get tight, they shorten and they close that space in between the vertebrae. So this space gets closed down as those muscles pull inward. That's what creates that long-term, that pressure on the disc, that pressure on the nerve, and starts to make the problem get worse. But it all starts with that muscle tension. All of those muscles originate from the base of your skull. When those muscles get tight, they pull down, and that's what causes that headache that you feel. And then that pressure down is what starts to create the potential for that crick in your neck, the radiating pain down your arm, and all of those symptoms that get worse. That's your number one sign that something's not right and you've really got to get some things checked out, and we can help you with that and check that out really easily and help you to get on the course to feeling better. But if you're just at this point in the beginning stages where you're still feeling this stiffness and just this tightness in your neck, then there's really a simple test that you can do to try to figure that out. And so what you would do is you would want to make sure that you're standing with your shoulders back and your chin tucked in a little bit so that you're trying to get your ear over your shoulder, so chin tucked back. And then all you're going to do is you're going to slowly just rotate to the left and back to the center, and to the right and back to the center. Now, two things you're looking for. One is, when you rotate, can you rotate the same distance to each side? And two is, when you rotate, can you rotate without feeling a tightness or a pull on either side? If the muscles in your neck are the length that they should be, you should be able to turn all the way without feeling a pull or a pinch here or on the other side as you turn. And then again, I ought to be able to turn as far to the right as I can to the left without that same pull. Ideally, you want to be able to turn so that your chin is just in front of your shoulder. Anything less than that is a sign that those muscles aren't as long as they need to be, and that's a warning sign that that stiffness is starting to progress and potentially cause you some much greater problems. So how can therapy help you with all of this? Well, the number one thing is we're going to be able to really assess and figure out what is causing those symptoms that you're having. More importantly, stop it in its tracks, keep it from progressing and getting worse. The second thing is that in most cases, it's gotten to a point where we need to do some manual things, some manual therapy to try to increase that space in between the vertebrae. Get the vertebrae further apart so that they stop pinching against each other. Get the pressure off of the disc and off of the nerve so that the symptoms come. Manually, passively stretch those muscles in your neck so that they are truly longer. Muscle is like a rubber band, and the longer that it is, the less pressure there's going to be. So even if you're just feeling some tightness and stiffness in your neck, there are manual therapy things that physical therapy here at Loudoun Sports Therapy Center can help you with. We'll get those muscles longer, we'll get all that pressure off and keep the problem from progressing. And then the final thing would be working on strengthening all of the muscles that run from the base of your skull all the way down your spine to about mid-back, and getting those muscles to be stronger so that they hold your head. Your head is about a 10-pound ball that sits on top of your shoulders all day long. And if I asked you to hold a 10-pound weight all day long, probably wouldn't make it through the day holding that weight. The same is true with your head. The stronger those muscles are, get you specifically strengthening the muscles that you see in this picture, those very small muscles, get you specifically strengthening them, will really help everything in your neck to be more conditioned and stronger so that that pressure doesn't develop. So again, if you had a positive sign of tightness and stiffness or pinching, or you couldn't turn your head equal distant on both sides, or if you just can't turn to your chin, even with your shoulder again, that's a positive sign that there's something going on with your neck. Here at Loudoun Sports Therapy Center, we can get you in, we can figure out what's going on, we can develop a treatment plan specific for you. So if that's the case, or if you're having any further symptoms of the radiating pain, real sharp pain, that crick in the neck feeling, that pinching, give us a call, click on the link below, we'll get you in, we'll get it figured out, we'll get you taken care of, and we will keep this from turning into a much bigger problem of a disc or a herniated problem or a pinched nerve, etc.